Now we're going to go to her lips, and again, for lips, we're doing the smooth tip, the 00. I'm going to occlude it, and because the lips are a little bit, stronger than the eye tissue, I'm going to put it up to about a 3.5. I'm going to keep the flow on my upper 90s. And my first question to Dawn is going to be, do you ever get cold sores?
Like once every 10 years maybe.
Okay, so
okay,
great. So if someone was getting cold sores, or if they had cold sores that they get maybe once a year, I recommend Valtrex before and after the SilkPeel treatment, just like a laser therapy, because this is a stimulating treatment, and the last thing you want is to stimulate a cold sore on the mother of the bride a week before the wedding. So I'm going to stay away from that area that Dawn told me about with her lips, and I'm not going to increase the vacuum. If Dawn said to me that she never gets cold sores and she has very dry, chapped lips, I would increase the vacuum probably up to maybe 4. But for the first time patient, you want to keep it at a 3.5, because you can still do a lot of infusing. And you can see the way that I'm doing the SilkPeel is sort of like how you put on chapstick. So you just stretch it. They can open their mouth if you want. You open your mouth just a little bit. Thank you. And you can see that if they have very kind of thin lips or a lot of crusties, you can just slowly go over it. You just don't want to suck up the lip tissue into the handpiece. So the key is to keep this taut, just like we did with the eyes. And everyone loves to get their lips done. As you can see too, Dawn's natural lip color is getting more rosy, like she is when her lips looked this way when she was about 12. So people love the plumping. They love the color that is stimulated by the exfoliation and the infusion. And this is why everybody at the Oscars goes to Dr. Fitzgerald's office and gets SilkPeels right before they go on TV. They do their lips and eyes, and they do a full lymphatic drainage. And the key is that the SilkPeel has so much to offer your practice. And if you're treating the SilkPeel like a regular microdermabrasion, it's not going to give you the amazing results and the wow factor that when someone finishes a SilkPeel, they look in the mirror and go, wow, my skin looks amazing. They see the volume, they see the lines reduced around their eyes, they see their plump lips, and they will rebook. If you're using it like a regular microdermabrasion where you're just doing these fast passes, you're not going to get the benefit of why your practice bought the SilkPeel.